noir plasma chrome bleed. Unlocking knowledge, inspiring innovation, empowering curious minds.
This website makes learning so easy. I found all my resources here.
Like what you share.
The celiac plexus is a complex network. Pathology here drives chronic pain. Sexual dimorphism shapes its structure. It dictates systemic autonomic interactions.
The celiac plexus, historically referred to as the solar plexus, represents the largest autonomic network in the human peripheral nervous system. It wraps around the celiac trunk, posterior to the stomach.
The celiac plexus is a critical integration center. It combines sympathetic and parasympathetic inputs. This regulates gastrointestinal motility.
The celiac plexus proper consists of a paired network of celiac ganglias. These are interconnected by a dense meshwork of fibers, both posteriorly to the adrenal glands. The celiac artery is the initial significant branch of the abdominal aorta. It typically trifurcates, a configuration known. This trunk supplies blood to the stomach, liver, pancreas, and spleen. Celiac trunk variations are determined by genetic factors. Atypical branching shifts the ganglia closer to or further from surrounding structures. This poses challenges during surgery or nerve blocks. Sympathetic fibers from T5 to T10 synapse here, using acetylcholine. Norepinephrine then causes vasoconstriction. Vagal fibers pass directly through, promoting digestion and secretion.
Fibers diverge from the celiac plexus, supplying the distal esophagus, stomach, duodenum, liver, and kidneys. Other plexuses include the renal, superior, and inferior mesenterics.
While the celiac plexus is consistent, significant sexual dimorphism exists. Pathways follow gender-specific vascular configurations. These follow configurations to regulate gonadal physiology.
In the female, the ovarian plexus arises from the renal and celiac plexuses. It provides direct innervation to the ovarian stroma, specifically targeting the theca and interstitial cells. The celiac ganglion connects stress to pregnancy. This axis links the nervous system to the ovary. Stress disrupts direct progesterone production. This directly impacts gestational viability.
The testicular plexus arises from the celiac and renal networks, following the testicular artery through the spermatic cord to provide autonomic innervation to the testes and epididymis.
Anatomical differences influence celiac plexus disorders. MALS is significantly more common in young adult females. This is due to developmental variations. In the female, celiac reproductive axis derives from the celiac plexus. In the male axis, a similar pathway is found, where the testicular plexus connects to the testes. The celiac reproductive axis. In females, through the suspensory ligament. In males, along the spermatic cord, forming the primary derived plexus. Mapping the celiac reproductive axis. In the female, the primary derived plex. In the male, the pathway drives signals direct testes, innervating the seminiferous tubules.
Celiac axis links directly to reproductive function. This plexus estrone and luteal activity. In males, it drives testicular togenesis. MALS causes severe vascular and nerve compression. Pathological conditions affecting the celiac plexus are classified into structural compressions, such as median arcuithic conditions, collectively referred to as celiac plexus neuritis. Inflammation of the celiac plexus may occur. Cytokines from adjacent organs irritate the fibers. This leads to severe celiac plexitis and neuritis. In celiac disease, gluten triggers an autoimmune cascade. Damaged villi send pain signals to the celiac plexus. Long COVID is linked to celiac plexus neuritis. Celiac plexitis involves severe inflammation of the celiac ganglia. Neuritis generates burning epigastric pain and autonomic dysfunction. This worsens after meals, causing gastroparesis. Instability can lead to tachycardia. Celiac plexitis causes severe pain. Pharmacotherapy targets the underlying pathology. Strict lifetime gluten avoidance is mandatory. Interventional procedures block nociceptive transmission.
MALS occurs when the median arcuate ligament compresses the celiac artery and surrounding nerves. This leads to pain that worsens with breathing.
In males, the median arcuate ligament sits too low. During expiration, it compresses the celiac artery. This directly irritates the overlying celiac plexus, triggering chronic neuropathic pain.
Median arcuate ligament syndrome causes intense pain. The ligament compresses the celiac artery and inflames the ganglia. This leads to severe bloating and nausea. Chronic pain often causes anxiety. Diagnostic protocols for MALS focus on imaging. Expiration reveals the classic hook-like narrowing. We must exclude other conditions like celiac disease. MALS is treated with surgical decompression. This involves dividing the ligament and ganglionic tissue. This provides significant long-term relief. Up to 70% find.
Comparing celiac plexitis and MALS, an inflammatory irritation of the celiac ganglia. MALS involves mechanical compression. One is inflammatory, while the other is structural.
Let's differentiate these two conditions. Celiac plexitis is inflammatory, causing burning pain and diarrhea, is structural, with severe pain after eating and weight loss. Proper diagnosis is key.
For many, eating brings agonizing pain. MALS causes structural compression, while plexitis triggers severe nerve inflammation. It worsens with exercise or breathing out, leaving patients in constant
Celiac plexitis is inflammatory, while MALS is structural. We use methylprednisolone and bupivacaine for a temporary block. This confirms the diagnosis as no long-term medical cure exists. Let's review celiac plexus vascular conditions. Plexitis is an inflammatory condition. MALS involves structural compression by the ligament. Treatments include nerve blocks or surgical division. Let's review celiac plexitis and MALS. Plexitis is an inflammatory condition of the nerve, while MALS involves structural compression by a ligament. Avoid dietary triggers and stop blood NPO status before surgery.
When pharmacological pain management is insufficient, interventional procedures targeting the celiac plexus are utilized. These are divided into temporary blocks and permanent neurolytic procedures.
A celiac plexus block is a minimally invasive procedure. It is designed to temporarily disrupt pain signals. It is indicated for non-malignant chronic pain, such as chronic pancreatitis.
Under imaging guidance, a needle is inserted. This targets the celiac ganglia for pain mediation. Anesthetic and corticosteroid are co-injected. This provides months of significant pain relief.
A notable clinical study highlights a new combined neural block treatment for long COVID. These blocks target specific autonomic pathways, 2-partil relief from pain and diarrhea.
Celiac plexus neurolysis is used for advanced pancreatic cancer pain. This involves the permanent chemical destruction of the celiac ganglia. Celiac plexus neurolysis is highly effective. It uses dehydrated alcohol to ablate the nerve. This induces protein denaturation, reducing severe cancer pain by up to 73%.
Interventional procedures carry inherent risks due to the celiac plexus's proximity to major vascular structures and the spinal cord. Before your procedure, stop blood thinners for several hours. This ensures you're safe. After the injection, for 30 to 60 minutes. You must arrange for a driver. Rest for 24 hours after. Side effects include soreness, bruising, and muscle spasms. Transient diarrhea occurs in up to 40% of intestinal motility. Vascular changes can cause orthostatic hypotension upon standing.
It feels like my solar plexus is rupturing. A ruptured solar plexus is actually a clinical misnomer. It's often catastrophic uterine rupture. This triggers a severe neurological shock response.
A uterine rupture is a life-threatening obstetric emergency. While rare in early gestation, it causes pregnancy loss. The primary risk factor is a weak uterine scar. This requires immediate surgery.
A miscarriage is a pregnancy loss before 20 weeks. Pathophysiology involves tissue regression and hemorrhage. Clinical stages progress from cramping tissue passage. Proper medical evaluation support are essential.
These stages vary by gestational age. Threatened miscarriage involves mild bleeding and cramping. However, the uterine cervix remains closed. This spotting can range from pink to brown. These stages vary based on gestational age. Inevitable miscarriage brings heavy bleeding and clots. If tissue remains, it is classified as incomplete. This requires medication or surgical treatment. During uterine rupture, the celiac plexus acts as a primary transducer. Tearing muscle and pooling blood stimulates neural pain signals, severe referred pain, and of ripping open.
Massive sensory overload of the celiac plexus can trigger a profound vasovagal response. This leads to severe cardiovascular instability, rapid heart rate, and low blood pressure.
The celiac plexus is anterior to the crura. Shock triggers spasms, mimicking getting the wind knocked out. This complicates severe obstetric events. Adrenergic signaling from the celiac ganglion directly regulates progesterone synthesis in the ovary. Acute autonomic stress can support and contributing to the failure of pregnancy maintenance.
Between 6 and 10 weeks, physical tissue characteristics change. Visceral pelvic pain and cramping often occur. Protocols include watchful waiting, misoprostol, or DNC.
The celiac plexus connects your brain to your gut.
Diet directly impacts its function. To support your autonomic health, focus on a clean, anti-inflammatory diet.
The vagus nerve communicates critical nutrient information. Vagal afferent terminals consist of mechanoreceptors and chemoreceptors. They detect distension and hormone release.
High-fat diets silence your gut's warning signals. They downregulate receptors, causing hyperphagia. This delays transit and triggers inflammation. Low-fat foods preserve sensitivity. They protect your autonomic nervous system.
For celiac plexus pain, large meals are a trigger. They distend the stomach and compress nearby nerves. Eat smaller, more frequent meals. This minimizes mechanical strain. For celiac patients, gluten is the enemy. It triggers an autoimmune attack on the intestinal villi, driving severe pain directly through the celiac plexus. A strict gluten-free diet is essential to heal. For pancreatitis, diet is key. High-fat foods trigger painful enzyme release. Focus on lean proteins and complex carbs. Eat 5 to 6 small meals daily. This reduces demand and eases pain. Allergy-specific dietary protocols. Adequate hydration is absolutely crucial. It helps flush out medications, and it supports your blood pressure. Drink up for your health. Chronic stress can impair your digestive health. It constricts abdominal blood vessels and inhibits peristalsis. To fix it, practice deep breathing. Follow for more gut health tips. Incorporating CBT and mindfulness supports healthy digestion. Also, smoking cessation is recommended. Tobacco use worsens vasoconstriction during celiac plexus procedures.
A highly complex integration center. It plays a vital role in digestion and pain transmission, exhibits key sexual dimorphisms, notably connecting to ovarian and testicular plexuses.
Pathological conditions such as median arcuate ligament syndrome require targeted interventional management. In obstetric emergencies, the celiac mediates the intense visceral pain associated with uterine rupture.
Supporting celiac plexus health involves medical and lifestyle strategies, nutrient-dense diet, hydration, and stress reduction to maintain balance and optimal function.
Like what you share.
This website makes learning so easy. I found all my resources here.
Noir plasma chrome bleed. Unlocking knowledge, inspiring innovation, empowering curious minds.